Hey guys, it's Dr. Justin Marcagiani here. I'm on like 3 months plus of my COVID-19 due. My hair is never this long. If I didn't have product in it, it'd be like in my eyes. Craziness. All right. So I'm always getting information, kind of passing my desk. People are shuffling things along and sending it my way. I saw a really interesting article in the New York Post on glutathione. It's a case study, so it's a little bit more anecdotal, but I've talked about the glutathione-immune-lung connection and how it relates to coronavirus and or COVID-19. So I'm really excited to share with you an anecdote on that today, as well as some scientific research, and just try to connect the dots for you, because we've talked about a lot of the approaches so far in medicine have been very defensive, right? I mean, kind of common sense. Wash your hands, social distancing, quarantine for certain people, right? That's kind of the defensive approach, maybe a mask. That's it. There's nothing about boosting your innate humoral adaptive immune response, right? Or even your cytotoxic response, which are like the natural killer cell. That's the first line of defense, the special forces of your immune system. So let's dive in a little bit deeper on this anecdote. So this article here in the New York Post, and it's talking about a mom with coronavirus was saved by her medical student's son. So essentially, this woman was really struggling. She had done the hydroxychloroquine. She was giving the antibiotics with the malaria drug, that's the hydroxychloroquine, but she still couldn't breathe, all right? The son, who was a medical student, basically knew a Lyme doctor, I think, over in Connecticut, and the Lyme doctor right here, Dr. Richard Horowitz, a Lyme disease specialist, recommended 2 grams, 2,000 milligrams or 2 grams of glutathione. The family witnessed a miracle, according to the family. Within an hour, breathing got better. It was amazing. I sat up, said Josephine. She could even start to make her bed and went and took a shower. She took the pill for 5 days and had no relapse, her son said. This is amazing. Now, there's mechanisms and studies to support this as well. So this isn't just a random anecdote in left field. I want to just bring actual information to everyone so they can start applying it and really make themselves healthier out the bat. James wrote up his mother's case in a case study, and he and Horowitz are co-authoring the study. So I'll pull that up here as well. This is important. The second patient told the Post he felt better in getting intravenous infusion of glutathione, which I think intravenous, especially if you're in the hospital, may even be better. And of course, we know vitamin C, or maybe it's not clear, but vitamin C also does help improve glutathione levels, and also it has a natural antiviral and really helps support your immune system as well. So I just wanted to highlight that here to people. There aren't enough of these case studies out there where natural compounds are really shown to be beneficial, and there's some mechanisms why. So I'll just kind of lay out some of the brief mechanisms, and then we'll talk about a study here. So number one, glutathione is made by 3 amino acids, the tripeptide. So glutamine, glycine, cysteine. These amino acids, even when you're maintaining proper nitrogen balance, meaning you're getting enough protein to exist for your physical structure, muscle, etc., which typically I think is 0.8 grams per kilogram. I think it's right around that. Or I'm sorry, 0.8 grams per 1 kilogram, all right? So there's FYI on that. And so in general with that, even with that nitrogen balance being adequate, you still may not have enough amino acids left over to actually make enough glutathione. That's vitally important. So you may get enough protein for what, nitrogen balance is required for you to maintain your mass, but you may still not have enough building blocks to make your glutathione. And then guess what? We know there's a correlation as you get older. What happens to stomach acid levels? Stomach acid levels drop. Well, we need stomach acid to actually be able to break down amino acids. So if you have less stomach acid as you age, now you're in a doubly, bad situation, because, okay, you may get enough protein in your diet, in your mouth, but you may not be able to break it down or absorb it. That's a problem. And so when we get enough glutathione actually helps to modulate inflammation. So it has a natural anti-inflammatory mechanism. Okay. It also has an immune modulatory mechanism, modulating cytokines in the immune system. And it's actually going to support the immune system's ability to be able to attack It will help your body produce natural disinfectants, right? We hear the word disinfectant. Your body actually has its own internal disinfectant called superoxide dismutase, and glutathione actually helps support superoxide dismutase levels, which actually can kill invaders and viruses and bacteria in your lungs. And your body actually produces that natural disinfectant, which is pretty cool. And these are really important things because you don't get health through wearing a mask or washing your hands, right? That's a defensive approach. We want offensive. If we can have a good offense and a good defense, right? Anyone that knows football, right? I'm a big Patriots fan. You get a good winning team, okay? It's really important. Let me show you this study here. Okay. All right. So this is the efficacy of glutathione therapy in relieving dyspnea associated with COVID-19 and pneumonia, a report case. That was the one that just came up that we just talked about. You can take a look at that. I'll put the links down here below. So this is the two patients, the mom here, and basically her improvement on that. And again, you can use N-acetylcysteine precursors, and alpha-lipoic acid is a precursor as well. Now, alpha-lipoic acid is not part of that tripeptide, but it does plug in and increase glutathione. So here's one study here, which is very, very interesting. Let me see if I got the longer version. I had the longer one. Okay. So the role of glutathione in immunity and inflammation in the lungs. So they talk about, there's extensive literature on the role of glutathione, that's GSH, in immunity, and most reviews are oversimplified where bad free radicals cause all sorts of diseases, right? So free radicals are these nasty compounds that come in and kind of damage the DNA, right? And then we have antioxidants like glutathione that can kind of come in and neutralize it. Vitamin C is also an antioxidant. Vitamin D acts as an antioxidant. Or actually, more it's vitamin A, C, and E are the big antioxidants. Vitamin D does modulate the immune response, though. And so it talks right here, talking about glutathione and its pathophysiology. Let's kind of go in here. So we talked about reactive oxygen species and oxidative stress. So oxidation is when you lose an electron. So if you lose an electron, now the cell's unstable. And when a cell is unstable, you may have free radical stress occur. So when you have a antioxidant like glutathione, you can actually donate an electron and stabilize that cell, all right? And that's really the big thing that glutathione does. It really helps with lipid peroxidation, membrane damage, and it gives off electrons to help stabilize cell. All right, that's really important. And you can see here hydrogen peroxide is going to be one of these natural things our body can actually produce to act as a disinfectant, FYI. So we have superoxide, hydrogen peroxide. So you actually can make some of these disinfectants in your body. But glutathione kind of helps quench it a little bit. Antioxidant defenses of glutathione. This is very important. So when dealing with lipid peroxidation, such as rancification, right? So when you eat bad fats, you will use a lot of your antioxidant stores to stabilize the cell membranes. One of them is vitamin E. We talked about that already. Vitamin E, vitamin A, C, and E. ACE is the recommendation. And then we have our tripeptide glutathione right here. There it is, glycine, cysteine, and then glutamic acid or glutamine, same thing, right? And this is what makes your glutathione here. This is the building blocks, okay? And so you can see here when you have glutathione, it's going to give off an electron here, and it's going to stabilize the cell. That's kind of going to be partly how it works as an antioxidant. Antioxidant means anti-electron loss. Oxidant means loss of electrons, so it's the anti-loss of an electron compound. That's what it's really doing. And there are many studies showing that experimental depletion of glutathione, which can be achieved by various chemicals, and you can actually support glutathione with N-acetylcysteine as well. That's a cheaper way to do it. It's helpful. I also recommend liposomal glutathione with it. That's helpful. Cysteine can be used as well. So NAC, cysteine, and actual glutathione is very helpful. We talk about the innate immunity and inflammation, right? Two sides of the same coin. This is what I was speaking on earlier. So we can see that it's going to actually help the immune system, the adaptive immune system. It's going to help you make antibodies and have a T-cell response, right? It's also going to help with your macrophages and phagocytes. These are going to help gobble up pathogens. Very, very important. It's also going to help modulate your cytokines, right? So we talked about cytokine storms where your immune system can actually overreact to the infection and create this cytokine storm. Glutathione can dampen that. Basically, it prevents the immune system from having an overreaction. And that overreaction can create a lot of symptoms. So glutathione really helps modulate that. Very good. Let me just keep on walking through everything here. So basically, the very same mechanism, it's implicated with glutathione, and inflammation and inhibition of these mechanisms is key to the mechanism of action in anti-inflammatory drugs. So what it's saying is it kind of works to reduce inflammation. It's kind of like anti-inflammatory drugs do. The difference is we're not going to have a lot of the side effects, which could be which would be liver stress or gut stress, right? Especially if it's a COX-2 medication that could really affect the liver, and that could affect gut health as well, and increase chances of ulceration. Right? NSAIDs killed 19,000 people a year taken correctly. Very important. Let me keep on showing you guys a couple more things here. Glutathione's synthesis and its precursors, right? 3 amino acids. We talked about that already. Very important. Glutathione deficiency. This is very important. So we talked about the natural nitrogen balance that we need. We need more protein than just having enough protein to support our body's muscle structure. We need more. It's very important. So right here, another important aspect is nutrition, as it was shown that even when dietary protein is sufficient for maintaining nitrogen balance, it may not be sufficient in maintaining cellular glutathione. This is super important. This is where supplements come into play. So someone that's like, hey, just have a good diet. It's all you need. Eat some good protein sources. You're fine. No, it may not be fine. You may need hydrochloric acid and enzymes even to have good digestion. You may need even more protein than you're comfortable with, right? And we may need supplemental amino acids, especially NAC or cysteine, or liposomal glutathione, because it's not as absorbed well, especially if you're already sick. We need to hit it therapeutically to really have an immune modulating effect, right? 3 big things glutathione is doing. It's modulating the immune system, right? So we have an appropriate immune response. It's reducing inflammation, right? And then it's also helping your body naturally deal with and produce its own disinfectants, like hydrogen peroxide and superoxide dismutase. Very important. So particularly in condition of oxidative stress, glutathione deficiency could arise from metabolic problems. So he talks about that, AIDS patients, right? People with certain genetic issues. And again, it talks about a lot of the different lung diseases associated with glutathione deficiency. And we know if you have a lung condition, right, the big one is going to be high blood pressure in this condition, is that is going to make you susceptible for COVID-19. So very, very, very important. There's a bunch more stuff here I could highlight. Studies show that sepsis decreases blood glutathione synthesis by 60%. So sepsis is going to be like the major thing that happens after a cytokine storm. So we know that glutathione is going to be reduced by 60%. So it makes sense. The more our immune system is stressed, we have to bump up that glutathione. That's vitally, vitally important. And one should bear in mind that infectious and inflammatory conditions are associated with an increase in production of acute phase proteins by the liver. So what that means is the more inflammation you have in your body, the more liver stress is on your body. So it makes sense that we want nutrients that will support the liver so it doesn't get stressed out by those acute phase proteins. So anti-inflammatory role of glutathione in the lungs. We've already talked about some of this briefly. It's going to have different effects with nuclear factor kappa beta. That's a big one. I don't want to go into all of this stuff. Just know it's going to have an effect modulating the immune system. Some of this stuff's kind of boring, but you can kind of see the protective effects of glutathione and repletion in lung diseases where it's associated with asthma, pleurisy, edema, lung damage, asbestos. So we know there's a lot of studies kind of already supporting that. You guys get that. It also is going to help this NRF2 pathway. NRF2 is kind of a big thing. There's this supplement, big multi-level thing called Protandim that was around a couple years back. That was a big NRF2 kind of compound, it kind of plugs into a lot of these anti-aging pathways that help with inflammation and regeneration and immune balance. Milk thistle plugs into that pathway, so does ashwagandha. Magnesium kind of helps too. So a lot of these nutrients, glutathione, will help plug into that NRF2 pathway. It's kind of a little side benefit, right? And glutathione is essential for the innate adaptive immune function. So what that means is you have an antigen. Antigen could be a virus, it could be a bacteria, some kind of foreign particle that responds to your immune system, and you make an antibody to it. So having a really good immune system, foreign substance, let's make an antibody, let's keep that thing from coming in and replicating and doing its thing in our body and creating stress. We need glutathione for that adaptive, innate immune response. For this kind of antigen antibody complex to happen, we need that good, healthy glutathione levels. Let me keep on rolling here. The essential role of glutathione in immunity might explain why in many diseases, not only AIDS, decreased glutathione levels are associated with increased susceptibility to infection, right? So we see it in COPD, cystic fibrosis, influenza, alcoholism, right? These are all very, 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 very important things. We know that connection is there. Glutathione and immune defenses against infections. For example, oxidative stress, influenza, all these things are really, really, really important. So all the things we already chatted about it earlier. Let me see if there's anything else that's important for me to highlight here for you guys. I think we hit all the major stuff here. So conclusion, glutathione from a simple free radical scavenger to a regulatory molecule. So we're not just scavenging glutathione, we're not just scavenging free radicals, right? We're not just trying to neutralize and give off an electron and stabilize these free radicals. We're trying to modulate the immune system. We're trying to regulate inflammation. We're trying to help support our body's natural disinfectant. So threefold here. Just trying to give you guys that that big kind of 1,000-yard view. It implies glutathione is an essential molecule for not only acting as an antioxidant, but in the absence of oxidative stress, as an endogenous signaling molecule. The molecule mechanism of glutathione-mediated redox. Redox means it's giving off electrons to stabilize cells, are being actively investigated and have only been part identified, meaning there's more benefits that there may be out there than the research even knows. So I just wanted to highlight for you guys. So my general first-line therapy for myself is I'm taking 2 grams of glutathione, or I should say NAC a day, and I will take glutathione acutely here and there, and I have glutathione stashed in my fridge in a liposomal form, so if there's any reason I need to acutely pull it out, that's going to be big. If you're older and you don't want to rely on the conversion of NAC to glutathione, you definitely want, you want glutathione there so you can get your levels up faster. And then there is going to be nebulized glutathione, which I highly recommend acutely. So if you're acute, right, you're having an active issue, you can do an IV. That may not be possible for everyone. Having a good nebulizer is going to be great because you can get it right into your lungs. You want to use a reduced form of glutathione. It's going to have a bicarbonate in there so it can mix with saline and be soluble and can be nebulized, and you can get it into your lungs. You can do, up to 500 milligrams. You could even do a gram a day if you're really acute. Usually they come in 200 milligram capsules, so you could do up to 2 to 4 caps, maybe 5 caps a day, up to a gram. Again, ideally try to work with a doctor if you're dealing with this acutely. If you're going to a hospital, your conventional MD may not work, so you may need to reach out to a good naturopath or a more open-minded MD or a good functional medicine doc to get more intel on it. So you have NAC capsule, you have liposomal glutathione, right? You have reduced glutathione, nebulized, and then you have your IV. Those are going to be your big sources below. I'll put my comments and my references kind of that I reviewed here below so you guys can take a look at it. I'll open this up for questions for you guys, see what you think. Let me know. And if you're enjoying this content, give me a thumbs up. Put your comments below. Want to know your thoughts. Give it a share for your family and friends as well so they can benefit from this really good intel. All right, let me just check in with y'all here. What's going on? Is it true that caffeine is a carcinogen? I know that plants will use it as a kind of natural insecticide. I do think when you cook it, it changes it a little bit. Also, when you bind caffeine to a fat, like in butter, it is going to be a little bit different, and it's going to kind of time release it. So I think there's a lot of benefits in coffee, so I wouldn't worry about it. Just make sure it's good source, no pesticides, no mold. Does glutathione also help lower liver enzymes? Yeah. We talked about like intermediary liver stress, so it definitely can help lower liver enzymes. You can also do liver tonifying herbs like milk thistle, which also do help with glutathione as well. Listen to your advice on glutathione months ago. A few weeks ago, before the hysteria, I purchased your suggestion for nebulizing it, and it's also brought the nebulizer you did with the demo. Awesome. Great job. Keep it up. Dr. J, what do you think about the trisomal glutathione? It is combination of reduced glutathione, acetylglutathione, and NAC in a liquid liposomal form. Sounds good. Sounds really good. I like it. Matt writes in, I wouldn't be surprised if anything could be a carcinogen given the right environment. Genes load the gun, environment and lifestyle pulls the trigger. Yes, I 100% agree. What we have control over are the epigenetics, right? If you have the fat gene, you better develop the exercise, movement, and good nutrition gene, right? And the sleep gene. For oral use, is vitamin C, ascorbic acid, a more effective form? Ascorbic acid's great. I mean, there's ascorbate, which is the reduced form, which is also great, and also make sure it's buffered, so we have that 100% dialed in. All right. If someone's older than 70 and has Hep C, is it okay to take cod liver oil? Someone's older, 70. Cod liver oil is very high in vitamin A. I'm okay with that. A tablespoon or two of cod liver oil, I think it's fine. If they have Hep C, you may want to look at supporting the liver as well with glutathione and milk thistle and some medicinal mushrooms like reishi too. Can you speak on what causes overreaction of the immune system, cytokine storm? So if you don't have a lot of these extra immune modulatory compounds on board, that I think is going to be a big factor, right? Why does the immune system overrespond? Well, I think there are natural nutrients that if they're on board, the immune system won't overrespond. So is it causative to say lack of glutathione, lack of vitamin D, vitamin C, too much inflammation in the body, insulin resistance? Could those things be part of why the immune system overresponds? I would say yes, but I can't say it for sure, right? I'm just basing it off of my clinical experience. People that have these nutrients on board and have a really good nutrient-dense, anti-inflammatory, low-toxin diet, 9 times out of 10 are going to not be susceptible, where someone that doesn't have them may fall sick and even ill. So I think these nutrients play a big role in having a more balanced, more adaptive immune response. Why bother with NAC instead of taking glutathione directly? It just depends on how good your health is. Sometimes NAC is good enough, but if you are actually sick or you're starting to come down with something lung-oriented, then you can kind of switch into gear. The reason why is just because of budget. It's just cheaper. It's just cheaper. That's all. That's the major reason why. Let me go to Facebook real fast for y'all. Can't they use immunosuppressant drugs like sirolimus? Are you talking about for the cytokine storm? I'm not familiar on the medications on that side of the fence. I know they were saying not to use ibuprofen because it could suppress the immune response, which would actually make it harder for the innate immune system to go and attack it. So the problem is you modulate something on one side, you may actually weaken the immune system, where a lot of these natural compounds will modulate the immune response but not weaken it. That's the benefit. What's the best advice of getting good drainage going? A friend's been dealing with sinus congestion, so doing the nasaline, doing the Neti X Clear packets, maybe adding some silver or some glutathione, some silver or some iodine drops into it as well. You can always do some natural things like ginger and burdock root. Those are all great. Antranex is basically just a lot of kidney support, right? That's a standard process product that's very high in kidney glandular tissue, which is very high in DAO. So if it's histamine stuff, it would definitely help with that too. Have you heard of glutagenic? It sounds like a name of a product. What's in it? They have a liquid to nebulize that has L-glutathione, NAC, silver hydrosol, oregano, sage, and clove. How do you know if it's real glutathione? I don't know about that. There's a lot of things in there, so I'm always very careful of doing things one at a time. So I'd much rather do glutathione, and if I want to, I can add some silver, or I can add a couple of drops of iodine. On the nebulizing side, I would feel comfortable with nebulizing glutathione. And then if you do a silver, nanosilver, I'd be open with a couple of drops of that too. How do you know if it's real glutathione? You got to just trust the company. You got to have a good company that's going to buy it from the best sources and have third-party independent testing on it. So there are good brands that are out there. I recommend you can go see Thur Naturals, justinhealth.com/glutathione. I recommend their product. It works good. I have it in my medicine cabinet for me and my family. It works great. And then a good nano silver, so it's nice and small. So if you do breathe it in, it's going to go right into your bloodstream and right out your kidney and liver, no problem. You want to stay away from big molecules of silver, 15 ppm or less, and you should be pretty safe on that. But speak to your doctor on the silver. Silver is a little more controversial. I've used it dozens of times with myself, hundreds if not thousands with patients. I think it's very safe. Are the antibody tests accurate? Yeah, they are. I interviewed, I'll just say it. Dr. Michelle Sands posted on her Facebook. She did the antibody testing. She did 5 in a row from Abbott. All 5 tested positive. So she did 5 in a row to test the accuracy. Abbott, I know US Biotech, who I sell as well, 97 to 99% specificity and sensitivity. All right. Any other questions? Nasal congestion, C. Patrick McEwen. Cool. All right. Any other questions, guys? Feel free to let me know. If not, be back tomorrow. One more question came in. The buffer glutathione you recommended has been out of stock for a long time. I know. It's because I blew them up, basically touting them on social media and on YouTube, and everyone bought them out, which is really sad. I mean, well, it's good for the business, but it's sad no one else can get it. Can this be made at home by adding sodium bicarb to reduce glutathione? Maybe only if it would have to be pure glutathione powder. So if you could get pure glutathione powder and you can mix it with a little bit of sodium bicarb straight, potentially, right? Potentially. But I'm not a chemist on that side of the fence, so I couldn't give you the guaranteed thumbs up. All right, guys, hope that helps. Good chatting with you all. Have a phenomenal day. Take care. Bye.